So dear students, so today we also learn regarding the liver function based on the dye test of excretory function and as well as the liver test, so the based on the abnormalities of serum proteins, and even we can study the regarding the liver function that was based on the serum enzymes. Okay, so liver having the certain role. Okay, so it was involved in the excretions of the particular compound in a particular rate. So that phenomena was helpful for to assess the liver function, because in the case of the malfunctions of liver or damage of liver, the rate of excretions of that substance, so that was decreases. Even the serum is the liver is the site for the synthesis of proteins. In constantly it can synthesize the certain proteins, so those are known as the plasma proteins. So the level of plasma proteins, so that was depending upon the conditions of the liver. If any liver problems or liver cirrhosis, hepatitis is there, so on that time, so those plasma protein level either decreases or increases. So that phenomena is also helpful for to screen the functions of the liver. Even certain enzymes are there, so their level was elevated or decreases. So during the inflammations or cancer or malfunctions of the organs, by targeting such enzymes, that was helpful for to assess the functions of liver as well as functions of kidney or functions of heart or conditions of the brain. So here today we can learn regarding the, so that is the assessment of the liver function test on the basis of the excretory functions, on the basis of the metabolism, that is synthesis of protein, or on the basis of the, that is the enzyme level. So first we learn regarding the dye test of excretory function. So those are helpful for to assess the liver functions. So there are mainly three synthetic dye are there. So those dyes are, that is the bromo sulfathalene, also known as the BSP, indocyanine green, and rose bengal. So these are three dyes. So these dyes are, when you are administered to the human beings, so their excretion rate is a constant, constantly, with minute to minute, constantly, so they are excreted. Okay, so monitoring of, so these that is the dye level in the serum, so that was helpful for to assess the LFT, because in the problems of the LFT, that is the liver function, that was, it was problem in the excretions of these substances, so they are failed to excrete. So due to that, so they are more accumulated in the serum. So assessment of these, so they can give the clue regarding the conditions or scenario of the liver. So commonly, so LFT, the dye test is used, that is the bromosulfathalene, as compared to the other, it is also known as the BSP. So regarding the bromosulfathalene dye test, so bromosulfathalene, it is a dye. It is mainly administered by the IV route. So it was helpful for, or commonly used to assess the excretory functions of the liver, because the excretory functions of liver is most important, because it can excrete the toxic substances like a bile, ammonia. Okay, so also many other toxic substances are there, that is the volatile toxic substances are there. So if you want to know, so how the liver can involved in the removal of the waste material, so that can assess with the help of the administrations of the dye. So that dye is known as the bromosulfathalenes. It is a non-toxic. It was mainly excreted by the liver through a bile. Okay, so in the normal individual, so the dye is removed from the liver or from our body. Okay, the rate is, that is 10 to 15% of dye, so that was removed per minute, whatever you are administered the dye, so that was removed around 10 to 15% per minute. Okay, so like a bilirubin, so this bromosulfathalene is also picked up by the hepatic cells or liver cells, and it can initiate the conjugations with the glucuronic acid. So that conjugated bromosulfathaline was excreted through a bile. If any biliary duct obstruction or if any hepatic cell toxicity is there or hepatic cells are damaged are there, so that conjugations reaction do not occur, or that pickup of the bromosulfathaline from the serum by liver cell, that was the decreases or diminishes. So due to that, the concentrations of the bromosulfathaline, so that was elevated in the plasma. So assessment or determinations of the, so that bromosulfathaline from the our serum, so that was give the clue regarding the secretory functions of the liver, or it is also helpful for to note down the obstructive jaundice. So regarding the method, so this BSP is administered by the intravenous route. The dose is that is the 5 mg per kg body weight. If the person having the 70 kg body weight means work, the BSP is administered around 350 mg. So that patient should be overnight fasting. So they want to assess the excretory functions of the liver, they should be fast in the overnight. So in the early morning, so they visit to the labs. So in the lab, the physician, so they are administered the BSP on the basis of the body weight of the patient around, that is the 5 mg per kg weight. And after administration, so those are monitor the, that is the plasma concentration or serum concentrations of the bromosulfathaline, so at 45 minutes and 2 hours. After 45 minutes, so they collect the blood and subject to the monitor with the help of the colorimeter. So special reactions are there or phenomena are there. So with the help of the colorimeter, so we can easily detect the how much of bromosulfathaline, so that was unconjugated, is found in the plasma or serum, because it is easily picked up by the concentrate by liver, that is a 10 to 15%. So that's why the here the serum was collected at 45 minutes. Then after 2 hours, once again the fresh serum was collected, because so every time, so that was excreted every time, so that level was decreased. So due to that, so with the help of the estimations of the bromosulfathaline from the serum, so that was helpful for to know the scenario of the liver or functions of the liver. Okay, so in a normal individual, so less than 5% of dye, so that was retained at the end of the 5 minutes. So whatever administered, so among only less than 5%, so that was retained. Remaining, that was conjugated by the liver with the glucuronic acid and excreted through the bile are stored in the gallbladder. So when you take the food, so with the help of the bile, that was excreted through the feces. Okay, in the normal results. But after 5 minutes, if the more than 50% dye, it was retained in the blood, it indicates, so there is a problem in the liver. So liver cannot be perform proper function. The liver may be the hepatic cells especially, so they are suffering from the hepatotoxicity due to viral infections or due to drug administered. So whatever the drug you are administered, if they are hepatotoxic or toxic to the liver means, definitely, so they are alter the liver function by cause the hepatotoxicity. So that was assessed. So with the help of the bromosulfathaline administered, so after 5 minutes, if it is more than 50%, if it was retained in the blood, whatever you are administered those, so among 41st, suppose you think if you administered 350 mg, okay, for that 70 kg persons. So among 50% means that is around one should be 170 mg. If it is more than 170 mg, it was retained in the plasma. So that was indicates the liver under the problems. So this test, that is the bromosulfathaline dye test, is also helpful for to differentiate the Dubin-Johnson syndrome as well as the Rotar syndrome. Simply both condition, the symptoms are same. Okay, in the case of the Dubin-Johnson syndrome, that is also written known as the, it is a popular as the DJ, then as well as the rotor syndrome. So these both are related to the hepatotoxicities, but doctor want to differentiate, because if it is familial history, okay, so that liver toxicity cannot be reversed. If the hepatotoxicity, so that is the due to familial history or from the genetic disorder, so that cannot be reversed, it is not possible. If it is due to entry of the viral infections or any chemicals, if they are caused the hepatotoxicity means, so that can be reversed with the help of the medicines. So where the doctor they want to differentiate, so whether the DJ or rotor syndrome, so that differentiation was done, so with the help of the bromosulfathalin dye test. Okay, so here this is the table. So with the help of this observation, so that was helpful for the differentiations of the Dubin-Johnson syndrome and rotor syndrome. So the Dubin-Johnson syndrome, so that was occurs due to hepatomegaly or hepatotoxicity. But the rotor syndrome, that is a autosomal disorder due to genetic disorder. So these are occurs in the children's. Okay, what the doctor they want to differentiate whether it is the Dubins or DJ or whether it is the rotor. So that was, so they can perform the, that is a bromosulfathalin test. So after that, if at 45 minutes, if the bromosulfathalin level is normal, but after 2 hours, if its level is increases, so that hepatotoxicity is related to the Dubin-Johnson syndrome. But at a 45 minute, the bromosulfathalin is higher level, but at the 2 hours it is a lower level. So that indicates, so that candidate was suffering from the rotor syndrome. So like that, so with the help of the bromosulfathalin or monitoring the concentrations of the bromosulfathalin from the blood after 45 minutes and 2 hours, so that was helpful for to differentiate the Dubin-Johnson syndrome as well as the rotor syndrome. So both are the related to the liver disorder, but the risk factor or causative agent, so that was the different. Dubin, it is occurred due to viral infection, but rotor, it is a autosomal disease or due to over activations of the immune system, so that can destruct the hepatic cells. Okay, that is also responsible for the cause of the rotor syndrome. So next we learn regarding the LFT based upon the abnormalities of the serum proteins. So already you know, so liver is the site for protein synthesis and as well as protein metabolism. So whatever you are taken the proteins from the food, so they are reaches to the liver as a small chain as a amino acids. That liver cells, so these are utilized the amino acids and as well as small chain can be break down into a amino acid, and those amino acid are subjected to the synthesis of the proteins. So protein is also utilized the amino acid, so that was metabolized by the liver. Okay, so and involved in the synthesis of the plasma proteins like albumin, globulin, seroplasmin, hepatoglobin, hemoglobin, then alpha fetoprotein, then as well as the alpha 1 antitrypsin. So many proteins are there. So they are found in the plasma, secreted in the plasma. So that was synthesized from the liver itself. Other proteins are also synthesized in the liver. Okay, so liver can supply amino acid and those amino acid utilized by the different organs. Then our glands, so those are involved synthesis of hormones or proteins. But this liver mainly involved in the synthesis of the plasma proteins. And those plasma proteins, so they're required for to maintain the osmolarity of the blood. Okay, also it was helpful for to maintain the specific gravity. If the plasma protein level was decreases due to malfunctions of liver means the internal hemorrhages occurs. Okay, so the doctor they want to find out the risk factor for stroke. Stroke is the one conditions, so that was occurred due to accumulations of the blood clot in the brain tissues due to internal hemorrhage. So why internal hemorrhage occurs? When the specific gravity or density or osmolality of the blood, so that was decreases. Due to that, the blood become more thin, it is easily infiltrated in the tissues, then where it is accumulated, then where it is coagulated, then it was responsible to cause of the necrosis of that part of the brain or organ. So that was known as the stroke in the brain. In the organ it is known as the myocardial infarction in the heart, or in the many organs it is known as the necrosis. So necrosis was responsible to cause of the death of the organ. If in the brain the stroke is occur means, then complete our system was fail. Suddenly the patient can be fall down, then that cause the death. So already you can note down in the TVs or some videos in the YouTubes. So the person they going to the bank, so they want to deposit the money within the counter, so they are die. Even one of the famous personality from the, that is the directors of the Punjab National Bank, so on the day of send up, so he's completed 60 years services, giving the 60 years services. On the end of the day, okay, he make the sign, the resignations, that is the, whatever the formalities are there for the relieving of the that services, so he can make the sign. After immediately he undergo the shock, because he having the attachment to that bank, withinly suddenly he can die. That is the stroke. So sudden shocks, so there was caused the internal hemorrhage of the brain, that was immediately, so that within the fraction second, so that was caused the death. So that internal hemorrhage is occurs due lack of the plasma proteins in the blood. Okay, if any internal hemorrhage is there, so doctor want to know what is the risk factor, whether it is related to the liver or any related to the other part. So that's why they are assess the LFT. Okay, they assess the concentrations of the plasma proteins. So if the plasma protein level in the blood was decreases, in the serum was decreases, means the liver under the problem. So due to hepatotoxicity, so these proteins like albumin, globulin and prothrombin, many hepatoglobin, that is the proteins or seroplasmins, so they are not synthesized. Due to that, so their concentration was decreases. That monitoring or determinations of the, so these proteins, so they are helpful for to assess the LFT. So commonly in the market the doctors, so they are assess the LFT through a determinations of serum albumin. The method is the bromocresol green, that is the BCG, and also the direct method is also available for determinations of the albumins. Then second, so they can determine the serum globulin, okay, through a electrophoresis. With the help of the electrophoresis, so they are monitor the globulin. So globulin is also the parts of the plasma protein, so they are involved in the to maintain the defense mechanisms like IgA, IgM, IgD, IgE. So these all are the globulins, all plasma proteins. So they are synthesized in the liver with respect to the microorganisms. So whatever microorganisms are enter in the body, so on that time, so that liver under supervision of the CNS or defense mechanism, it was involved in the synthesis of the particular type of the globulins. Okay, so if the liver is in the problem means, so those hormone levels are either increases or decreases. Assessment of these serum globulin is also helpful for to assess the LFT, or indirectly these serum globulin is also calculated by by monitoring the total serum protein minus serum albumin. Then also you can got the idea regarding how much different component, defense component, so they are present in our blood. Okay, also the determinations of total protein, the total protein nothing but the summation majorly albumin plus globulins. Many other proteins are there, but majorly the total proteins are known as the albumin plus globulins. So that total proteins was monitored by a biurate reactions by using the copper sulfate. So amount, how much amount of proteins are present, it can give the precipitate. So on the basis of that precipitations, we can monitor the how much total protein so they are present in the plasma or blood. Okay, so as well as so with the help of these monitoring albumin, globulin, total protein, we also helpful to calculate the ASA ratio. Okay, the albumin globulin ratio. So it is also signifies the various disorders or that is the liver disorders, and also the prothrombin time PT, nothing but clotting time. So how much time is required to clot the blood, that was also depending upon the liver, because liver is also involved in the synthesis of the prothrombin or synthesis of the coagulation factors. And prothrombin coagulation factors, so they are play an important role in the blood coagulations. If lack of prothrombin, the coagulation time or PT, prothrombin time, was increases. If the PT time was increases, it denotes there is a liver problem or liver under the problem. So these are the common tests. So nowadays, so they are used in the LFT or liver function test. Many others are there, but they are not used. But commonly, so these are the assess. So that's why should be have the knowledge. So first one we can go for the, that is the serum albumin test. So here the doctor, the physician, they target the albumin in the plasma and note downing the diseases related to the, that is the liver and as well as kidney, because albumin is a plasma protein, so that was mainly synthesized in the liver and excrete. Okay, so in the kidney diseases it was more excreted, but it is not excreted overall. But in the case of the kidney disease, it was found in the urine. So that's why it is helpful for to assess the functions of the liver as well as kidney. Okay, so the normal range of albumin is, that is a 3.4 to 5.4 gram per deciliter. If regarding the percentage, the plasma proteins in our blood is a 7%. So among 7%, 58% is a albumin and 38% is a globulin and 4% is a fibrinogens. So that's why the total protein means albumin plus globulins. Okay, so these assessment of the serum albumin, so that was helpful for to assess the liver function. And the half life of the albumin is a 20 days. In the case of liver damages or liver cirrhosis, the serum albumin level, so that was less than the normal. If you are monitoring the serum albumin level, if it is less than 3.4 gram per deciliter, that indicates so that person is suffering from the kidney disease or suffering from the liver diseases, example hepatitis, cirrhosis or many other liver problem. So that can denoted by monitoring the serum albumin. So if the serum albumin, if it is less, it can denote the that candidate was suffering from the liver disease or kidney disease. The normal range is the 3.4 to 5.4 gram per deciliters. So next one is the, there is serum globulin test. Serum globulin, their concentration is the 38% in the plasma. So these globulin, so they are mainly synthesized in the liver. Okay, so they are mainly involved in the defense mechanisms, and these synthesize in the liver. If any problem in the liver, even the microbial infection, viral infection, if liver under the hepatotoxicity or hepatic cells are the malfunction, then so these immunoglobulin level is altered. Okay, so these serum globulin, so they are monitored by the electrophoresis method or by using the electrophoresis. So that's why serum globulin test is also known as the serum globulin electrophoresis test. It is used to measure the levels of the protein called globulins in the fluid or parts of the blood. So regarding the normal range, the serum globulin is 2 to 3.5 gram per deciliter, and IgM component, so that was 75 to 300 mg per deciliter. So this IgM now it is can used for detections of the COVID-19. Okay, then Ig component, this is the 650 to 100, that is 1850 mg per deciliter. So normally, so they are found in the plasma. Okay, then also Iga component, that is 90 to 350 mg per deciliter. So this is the normal range of the different types of the that is the globulins. Okay, so regarding the Iga, so it is increases in the case of the alcoholic liver disease. If the only, so the IgA level was increases, so that can denote, so the liver is suffering from the liver damage due to use of the alcoholic patients. If you want to know the scenario of the liver in your patient, so they are the heavy drinker. If anyone your family member or any your relatives or friends, so they are the heavy drinkers, so now you are the aware regarding the toxicity of the alcohol. Now you want to know what is the scenario of our liver, so then you can go for the IgA test. If it is increases, that indicates the liver is under damage. So then, so with the help of the withdrawal of the alcohol or limitations on the alcohol, along with by maintaining the balanced diet or healthy diet, the diet which contain rich of amino acids, multivitamins along with the glutathione, then it can reverse the, or it can treat the liver damage that is due to alcohol. Still you having the, because the liver is a regenerative organ. If only 1% liver is survive, means it can convert. If you are maintaining the healthy diet along with the treatment, means then 1% become the 100%. Still you have the chance. Okay, in your patient, if the patient is under the chronic alcoholisms, so then you can go for the IgA test or globulin test. Then you can got regarding the scenario of the that is the liver, or you can go for the LFT in the specific period, that is the once a year or twice a year. Okay, then the IgM, so its level was increases, that can denote the, that is a primary biliary cirrhosis, there is a problem in the biliary ducts. So that was where the IgM level was increases in the serum. If IgG is increases, so that can denote the person was suffering from the autoimmune hepatitis. That is the over immunity power that can destroy the hepatic cell. So now it is also happens. Okay, so everyone they are told take the CADA. Okay, so then it can improve your immunity, then free from the COVID-19. But what happens after 1 year? Daily some people daily they taking the CADA 2 times, 3 times. Some people they forget water, only they take the CADA. So what happens? Definitely those people they are free from the COVID-19 due to improve the immunity in their body. But definitely that overactivations of immunity was responsible for the hepatitis, failure of the liver. Even the overactivations of immune system, it can causes the lupus disease where the skin was separated, and also overactivations of immune system that was responsible for to cause of the cancer. So that's why, so you are the ideal clinical pharmacist. You always you can guide the your neighbors, your family members, so they should be user restricted. So immune power is also improved by taking the healthy diet or good snap, that is sleep. You always maintain the sleep, that is a more 8 hours. Then create the always the healthy environment. Always you can avoid the fear in your family member, that is the first your aim. Always now with the third phases came in the Maharashtra, many people they are conscious, so those, so they are more love to their family member, they are conscious, but they are only anxiety and they are only sufferer. But your aim is you can avoid the anxiety by following the precautions. You avoid the crowd, you avoid the going to outside, and in family you always keep the healthy environment. You can insert the small activities in your family members only. So that was neurosis the, that was enhance the positive energies or positive environment in your family. Then they are free from even the patient, So they are free from the that type of the depression that is the needed. Okay, so like that the serum albumin and globulin, so they are helpful for to assess the liver functions. So next one regarding the total proteins. The total protein means the amount of albumin plus globulin, because so their percentage is the high, that is the albumin is the 50% and the globulin is 38%. By calculating by summations of albumin and globulin, so we can got some that was known as the total protein. It is the test to measure the total amount of albumin and globulin in the body. So this total protein was assessed, so with the help of the biuret method or by following by the photometric test by using the copper sulfate. So regarding the significance, it is a part of routine health checkup. So if you want to know your health, because health is depending upon the proteins, the proteins decreases means hormone level decreases, steroid level decreases, or even our muscles strength was decreases, then you are unhealthy. If having the good total protein means, so then you are considered as the healthy some extent. And also it may be also used the person if unexpected weight loss without any exercise, without any medication, gradually the weight is lost. And unexpected weight loss means within month, if the loss of weight is more than 5 kg, then it is considered as the abnormal weight loss. Even you are going for the exercise, even you are taken the certain medication, therapy and recipes. Okay, that is the food recipes. If your loss of weight is more than 5 kg mean that was count for the abnormal weight loss. That is also assessed with the help of the by assessing the total protein test. Even if you are fatigued, then they assess the total protein. And if having the mild symptoms regarding the kidney and liver disease, then also the doctor they can go for to note down the scenario of the total protein that value was altered. Okay, so regarding normal range, so the normal range of the total protein is, that is the 6.4 to 8.3 gram per deciliter. It is considered as the normal range. If it is increases, it denotes, if it is more than 9, that can denotes the person was suffering from the inflammation or infection such as viral hepatitis B, C or HIV. If the level was decreases, because in the case of the HIV hepatitis, the muscular dystrophies occurs. Due to that, the serum having the more protein, the muscles become the weak, okay, or fragile. Then if the total protein level was decreases less than 6.4, okay, so that is known as the hypoproteinemia. It is causes in the case of the liver disorder as well as in the case of the kidney disorder. So regarding the AGA ratio, that is known as the albumin globulin ratio. It can refer the quantity of albumin in the blood compared to the amount of the globulin in the blood. It was compared with the globulin. And AGA ratio, so that was calculated by using this formula, that is albumin level. So albumin is calculated by the direct method. Okay, then the total protein, it was calculated by the burette method. Then minus albumin level, you can got the AG ratio. So normal AG ratio is 1.5 to 2.5 ratio 1. So albumin that is present 1.5 to 2.5. Then the globulin, that is the 1. If albumin present 2.5 means the globulin is the 1 gram. Okay, that is the normal EG ratio. If the ratio was decreases, if the lower albumin globulin ratio, so that can denote the increase the globulin level, automatic albumin level was decreases. So the globulin was increased in the case of the lupus, the over activity of the immune system. Okay, so that can cause the lupus erythematosus or lupus syndrome. Okay, that is known as the overactivations of the immune system. And also autoimmune diseases, so where the globulin level was increases, then the AGO ratio was decreases due to increase the globulin. Automatically, the albumin ratio that was decreases. So that can denote. And also, in the case of the liver cirrhosis and nephrotic syndrome, the level of AGO ratio, so that was decreases. And high level of albumin globulin ratio, so that was seen in the case of the decrease the globulin level, automatically the albumin level was increases. So in the case of the hypothyroidism or leukemia or some genetic disorders, so where the globulin level is decreases, automatically the albumin level is increases, the ratio can be altered. So that can denote the person was suffering from the hypothyroidism or leukemia or some genetic disorders. If the level was decreased albumin level, that is due to increase the globulin level that was seen in the lupus and autonomic diseases as well as liver cirrhosis and nephrotic syndrome. So now we can learn regarding the prothrombin time. So regarding the prothrombin time, so prothrombin time is also known as the PT. It is the time in which our blood liquid converted into a semi-solid like substance. Simple, it is a blood coagulation. And blood coagulation, it was mainly depending upon the prothrombin. Prothrombin only, it was converted into a thrombin in the both cases. Intrinsic blood coagulation as well as the extrinsic blood coagulations, various coagulation factors. So they are activated. Then they are involved in the activations of prothrombin. Then the prothrombinase, it can convert prothrombin into thrombin. So that thrombin, it was responsible for to convert fibrinogen into fibrin. Then fibrin undergoes structural changes. Then it becomes semi-solid like substance. That entire, it was depending upon the prothrombin. And prothrombin, it was mainly synthesized by a liver, and the half life of the prothrombin is a 6 hours. Okay, so this assessment of the prothrombin time, that is a helpful for to assess the conditions of the liver. So because so the normal PT time is 10 to 15 second. Okay, if PT is prolonged, so that can denotes the liver can loses 80% of reserve capacity. If the PT was prolonged means, so that can indicate the liver is 80%. It can, the hope was fail to reverse the liver capacity. Okay, so commonly PT used for detecting the liver coagulopathies, and as well as, so you note down that is a vitamin deficiency, that is a vitamin K, it is required for the that is the prothrombin. So in the case of the liver diseases, the PT remains prolonged even after administrations of the vitamin K. If the PT is prolonged, then the doctor they administer the vitamin K, because vitamin K, it was required for a synthesis of the coagulation factors. In the case of liver disease, even the vitamin K administered, the PT time is increases. So that can denote severe liver disease where we can lose the 80% of hope that can reverse the liver functions. So that can assess by this method, that is the our blood can be centrifuged, then the blood supplement layer is calculated, then note down in the, so when the fibrin clots are appear. So this is the node downing of the prothrombin time. So that was if normal time is 10 to 15 seconds. If the time is increased means that can denote the severe liver disorders. So that's why the PT is commonly used or frequently used, not commonly, frequently used in the case of the liver transplant. When the liver transplant is needed, so that is also determined on the basis of the PT, because the PT product means that indicates we can lose the 80% of the hope, so that can reverse, liver can reverse, because already I told to you, if the liver 1% can survive means it can reverse with the help of the healthy diet and food. Okay, but that was treatment therapy, that was depending on PT time. If PT time is normal means, then it is possible to reverse. If it is increases means, then we can lose the 80% of work only we required to transplant the liver. After transplantations only, the doctor, they can time to time they calculate the prothrombin time to know down whether they need to know down the whether liver is correctly work or not. So next one, so that is the LFT that was based upon the serum enzymes. So various enzymes are there. So among commonly used enzymes in the market for assessment of the liver function test are the transaminase, that is alanine aminotransferase ALT, SGPT, and aspartate phosphate, that is the AST and SGOT. So these cells, these uh, enzyme level, so they are always normal without, that is a less than 40 unit per deciliter, so they are found in the plasma. But when the hepatocyte cell are damaged, the hepatic cells, so they are damages, so then only, so their level was increases in the our serum. Okay, so that's why with the help of transaminases we can know the hepatocellular damages. If the level was increased, mean definitely can denote the liver cells are damages. Then, so also in the market commonly used, that is the determinations of alkaline phosphatase, 5 nucleotides, and as well as gamma glutamyl transpeptide, also known as the GGT. So these three, so these are marker for to note down in the obstructive damage of the biliary ducts or livers. Okay, so they can know the any obstructions in there in the liver or gallbladder. So that can be assessed with the help of the alkaline phosphatase and 5 nucleotides, and as well as GGT, that is a gamma glutamyl transpeptidase. So regarding the first, that is the aspartate aminotransferase, also written as the AST, it is also known as the SGOT, that is the serum glutamate oxaloacetate transaminase. Okay, so this enzyme is more in the liver, and ACT is found in the both cytoplasma as well as in the mitochondria. So the normal range of the AST is a 10 to 45 unit per liter. Okay, so AST, that is the SGOT, it can helpful for to note down the damage of the hepatic cell, but it is a considered as the less specific marker for liver disease. So in the case of the liver cell damage, so that much not reflect on the in certain cases on the AST level. But in the case of the cardiac toxicity or damage of the cardiac cell, definitely, so this enzyme level was increases. So that's why, so this marker is more specific to the cardiac toxicity as compared to the liver toxicity. ACT is also help in the diagnosis of heart, muscle or brain disorder, even the myocardial infarction or heart attack. So this AST level is mainly elevated in the case of acute hemolytic anemia, cirrhosis of liver, hepatitis, acute pancreatitis or inflammations of pancreas, then acute renal failure or loss of kidney function, heart attack, primary muscle disease, and recent surgery. Simply, if the any persons having the problem in the digestions, okay, so their abdominal cavity are always swelling, and also he is suffering from the fatigue, that can denote the malfunctions in the digestions. So then you can go for the that is the AST SGOT. If its level was increases, means that can indicate the acute pancreatitis or inflammation of the pancreas. So on the basis of the sign and symptoms, then the doctor, they can go for, or pharmacist, then can go for to monitor the SGOT level or AST. Then they confirm. So this maldigestion was due to pancreatic problem because of digestive enzyme that was secreted from the pancreas more. If problem is there in the pancreas, we do not got the digestions. Then there is the problems. Okay. Then also in the case of the other disorder, so this enzyme level was increased. So that's why this enzyme was helpful for the diagnosis of the various disorders. So next one is the alanine aminotransferase, that is the ALT, or also known as the serum glutamate pyruvate transaminase, that is SGPT. So this enzyme is mainly found in the liver, so that's why helpful for diagnosis of liver disorder. Cardiac muscle also helpful for the to assess the cardiac function. Even so, this enzyme is helpful for the to know down the myalgia or fibrosis in the legs, because it is also present in the skeletal muscle. The mass of the skeletal muscle or conditions of skeletal muscle is also monitored with the help of the SGPT. If the person is having the prolonged fatigue, okay, he are unable to maintain the locomotions or movement. Okay, so then simply you can go for the SGPT or ALT. If its level was increases means, so then it can denote a severe problem in the skeletal muscle. If it is normal, then that fatigue is related to the any other problem, that is due to lack of the ATP, or the body weight was increases. It can create the more problem on the leg muscles simply. Okay, so that a normal level of alanine transferase in the male, that is 13 to 35 unit per that is the liter, and female is the 10 to 35 unit per liter. If the level was increases, there is 50 to 100 unit per liter, that was considered as the moderate abnormal levels of the ALT. It can denotes the person is suffering from a chronic liver disease, hepatitis, then NASH, that is non-alcoholic steatohepatitis. Then if the level is increases, that is 300 to 1000 unit per liter, it is considered very high abnormal levels. That can indicates the acute hepatitis, toxic or viral infections to the our liver. So on that time, the ALT or SGPT level is more than 300 to 1000 unit per liter. So this ALT SGPT level elevated is also seen in the case of the alcoholic liver disease, cancer of liver, hepatitis or inflammations of liver, non-cancerous tumor of the liver. Then there is a toxicity due to use of medicines or drugs, and even in the case of the cirrhosis or scarring of the liver or death of the liver tissues. So where so this enzyme level was increased. So that's why so this enzyme is considered as a specific biomarker for assess of the hepatic function cell. Okay, that was helpful for to know down the conditions of the hepatic cells, whether they are damages or healthy. If they are damaged means definitely, so these level hormone level, sorry, enzyme level, so that was increased. So like that the ALT or SGPT, it is specific considered as the specific biomarker for the liver disorder. So next one, so regarding the AST ALT ratio, that is also give clue regarding the diagnosis of various disorder. So normal AST ALT ratio, so that should be 0.7 to 1.4. So if the ratio is more than 2, that is the AST is higher. Okay, that is the ALT is the more than higher than the AST, then it indicates alcoholic hepatitis, hepatitis with the cirrhosis, non-alcoholic steatohepatitis, that is the NASH, and also erythromycin treatment. So where the ratio can be increases. If the ratio is zero point 0.8 and where the only the LAT level is higher. Okay, the ratio is higher than 2 due to where the AST level is higher, then denotes this disorder. If the ratio is less than 8, then ALT level is higher. Okay, so then can denote the acute hepatocellular injury, toxic exposure, the any toxic substance are entering our body like chemicals, pesticides, so from the foods or from the preservative as a preservative in the foreign imported food. So there were the LT level is higher and ratio was decreases. And also extra hepatic obstruction. So like that the LT, AST and ALT ratio is also helpful for the diagnosis of the or identifications of the various disorders. So next one we can go for the alkaline phosphatase, that is ALP. The source of ALP is a liver, bone, placenta and intestine. It is also considered for the monitor of the liver dysfunction, but it is not a specific biomarker. It is a specific biomarker for bone disorder. because this alkaline phosphatase level, it was involved in the mineralizations of the phosphate. Okay, so during the mineralizations or development of the bone, if any malfunction, then the enzyme level was altered. So that's why it is considered for the specific biomarker for the skeletal system. So the normal, the range of the ALP is 40 to 125 unit per liter. So certain factor you are also consider for the motor of the, or consider of the alkaline phosphatase in the case of the LFT, or in the case of the bone disorder or placenta disorder or intestine disorder. So these following four factor you also consider, because so this level was increases in the old people because the bone is more deteriorated. Okay, so the deteriorations, the development of the bone was decreases. So were also the alkaline phosphatase level in the bone is more. If it is in the more in the young means, so that indicates there is a malfunctions in the bone mineralizations, or there is a problem in the, there is a hyaline cartilage or epiphyseal cartilage, so that was failed to absorb the calcium's minerals from the blood due to any microbial infections or viral infections or use of the certain kind of the drugs. So that was matter. But in the case of more than 60 years, definitely, so that level was increases in the, as the age is going on, the development of the bones can be stopped. That is also considered. Okay, not you can conclude that so this candidate was suffering from the liver disease if he just more than 60 years and the ALP level was increases. That is also you can consider the age is also considered for the diagnosis of disease by through a monitoring the alkaline phosphatase. And also in the case of the pregnancy, okay, so on time also in the female the level was increased. That is also account for your counseling or diagnosis. Okay, and also the in the blood group O people and B, so after meal the influx of ALP into the blood is also increases. In the case of the blood group O and B, so they always having the ALP level more after the meal. That is also can consider. The blood group is also reflect on the alkaline phosphatase level. So in the case of O blood group, B blood group, so that was increases after the meal. Okay, so that is also you can account for. If the patient is O and B, then if you taken the fatty meal, then you can consider. Then in the case of the children or adolescent during the rapid bone growth, this enzyme level was increased because it is involved in the phosphate mineralizations. Then if it is increases 2 to 3 times more, that is considered the moderate increase. In the case of hepatitis disease, include infective hepatitis, hepatocellular carcinoma, the level was increases 2 to 3 times more. And 10 to 12 times more increases mean that is considered as the very high level of the ALP. In the case of the obstructive jaundice or gallstone, the LP level is more, that is about 2 to 10 to 12 times. If it is more than 12 times as compared to normal range, that was considered drastically high level. That is not related to liver disease, but it is related to the bone disease such as rickets and osteomalacia. So where it was increases more than 12 times. So these are the various isoenzymes of the ALP that is also considered for the diagnosis of the various disorders. Regarding the case of the obstructive jaundice, the alpha 1 ALP is helpful. But in the case of the other disease, the other isoenzymes of ALP, so they are used to diagnosis of the disease or confirmations of the disease. So next one, so that is the 5 nucleotides. So it is the normal range is, that is the 2 to 15 unit per liter. So this serum 5 nucleotide is elevated in hepatobiliary disease parallel to the ALP. So along with ALP, it is also increases. So then it can denote the person was suffering from the hepatobiliary disease. Okay. So then the 5 nucleotides is normal in the case of patient with the bone disease where serum ALP is increases. So this is also beneficial. If only ALP level is increases and 5 nucleotide level was not increases. So that increase is not related to liver, it is related to the bone disease. So that's why that this 5 nucleotide is another enzyme that is also helpful for to differentiate the liver disease as well as bone disorder. So next enzyme that is known as the gamma glutamyl transpeptide is also commonly used as the GGT. Okay, in India it is not used, but in a foreign countries it is commonly seen in the diagnosis report. The normal range is once again 10 to 15 unit per liter. This is a microsomal enzyme widely distributed in the body tissues including the liver. Okay, so the measurement of the GGT, it is helpful for to give the product sensitive index to assess the liver abnormality. Okay, the serum GGT level was elevated in the case of the biliary obstruction and alcoholism. And also, the GGT level is increases in the case of the chronic alcoholism, pancreatic disease, myocardial infarction, renal failure, and diabetes mellitus were also the GGT level was increases. And also in the case of the use of certain drugs like phenytoin, okay, so where this enzyme level was also increased. So that's why, so this enzyme was targeted to identify the phenytoin intoxication. So when the phenytoin is the first line drug commonly used for the treatment of the febrile seizures or epilepsy. So then more continuously monitor GGT level. If its level is increases means that it denote the toxicity of the phenytoin that was induces or that was produces. So next one we can consider few highlights regarding the how will you manage an asymptomatic patient with abnormal LFTs. Okay, so abnormal LFTs are there, but liver was not fail, liver was healthy. Still, the abnormal liver function test or result is occurs. Okay, so that was known as the asymptomatic patients. Okay, and also the patient do not have any okay conditions or symptoms, but result can show the abnormal LFT, so that will be managed like that. So that the clinical situation that increase the bilirubin only, only the bilirubin level of increases, because it is not indicate that he can suffer from the jaundice. Okay, but you can take the actions like recheck the conjugated bilirubin level and also exclude the hemolysis. Then management, research the like Gilbert syndrome. Once again, you can monitor the whether he is suffering from the Gilbert syndrome or not. Then increase the GGT level only, so that can you can determine whether alcohol is excess or enzyme induction by any drugs or increased BMI. The management is you can withdraw the alcohol, and sometimes there is no action in the case of the drug, or in the case of the increased BMI, then start to plan to lose the body weight. So like that you can manage the that abnormal LFTs. Okay, because the liver was not fail, but GGT level is increases. GGT level increases means definitely we can note liver is fail, but it is not liver fail. That was due to alcohol excess or any drug can induce the enzymes or any increase in the body weight. So like that you can manage withdrawal the alcoholisms, or in the case of the drug you can manage the food but not withdraw the drugs. Definitely don't withdraw the drug, because if drug withdrawal means definitely that whatever disease is there that was progressed. Okay, but you can manage that liver giving the healthy nutritions, or also reverse when the therapy was stopped. Then increased BMI is there means then you can start plan to decrease the weight or lose the weight. Okay, so next one regarding the abnormal alkaline phosphatase or serum transaminase, it is less than 2 upper limit of normal. Okay, so if it is increases abnormal alkaline phosphatase less than 2 upper limit of the normal. Okay, abnormal alkaline phosphatase the upper limit is that is around 25 units. Okay, so then the serum transaminase it is a 40. If it is just less than 2 upper limit normal, so then you can know the conditions of whether he is alcoholic or he can using the hepatotoxic drugs or having the overweight, then advise to lose the weight, and check the GGT if it is raised along with the alkaline phosphatase, and recheck the LFT in 3 to 6 months. Okay, so then the management is a due to dilated bile ducts, you can adjust the condition you can dilated the ducts, then it can easily pass the bile. And also you can go for the colonioangiography, MRCP, ERCP. They can helpful for to note down the obstructions in the bile ducts. Due to that, the bile cannot be secreted from liver into the gallbladder. So on that time also, so these levels are abnormal. Then persistently abnormal LFT. So then once again you can recheck the LFT in 3 to 6 months, and also you can go through the liver screen, full history of chronic liver disease screen, ultrasound of abdomens or assessment of the SBAZ, HCV-AB, then as well alpha 1 AT autoimmune profile for teen seroplasmin immunoglobulins, persistently other abnormal LFT. Then that is related to the non-dilated bile ducts, and also consider liver for biopsy and treat the underlying disorders. Then abnormal alkaline phosphatase or serum transaminase if more than 2 into upper limit of normal. Okay, so these are the action you should be take, and these are the management parameters. So like that, if you go in the first time, if you can got the abnormal LFT means, you can once again you can recheck. Okay, in certain other cases also, the LFT should be the abnormal, and such patients are considered as the asymptomatic patient. Okay, but there is no symptoms, but the result can show the abnormal LFT. So that can manage in the that is the due to that is the weight due to that was also LFT or any alcoholic or any drugs. Okay, so you can manage so like that.